So as a chiropractor, one of the most common things that I see is back pain. It's my job to work out why people have back pain. So I take you through a range of motion. And the first thing I see is I ask people to bend forwards and they go like this and can't touch the toes. Toes, distant thing, memory of the past. So they come back up again. I say, okay, well, can you bend over and touch your toes if you bent your knees? Ah, yes, can do that. Oh, there we go. Oh, and there are my toes. But, oh, my knees. Really, really painful. What's the problem? The problem is that people are not using their hips. Hips are one of the joints in the body with the greatest range of motion, and one of the most poorly utilised joints when it comes to lower back pain. So if I was to then hold on to people's backs and say, right, keep your back straight, stick your bottom out a little, and now bend forwards as if to touch your toes. Actually, there they are, the toes. Knees are fine. Little bit of tension in the hamstrings, but I haven't used these hips for a very long time, so of course I got tension as soon as I want to actually stretch my hamstrings. So, how do I teach people to do this in their day-to-day life? Well, the best way is through a squat. And we do a squat by hinging at the hips and bending the knees. And I don't want the knees to ever go more than 90 degrees and then come back up. But I don't want to do squats. Squats hurt my knees. I can't do squats. I've been told it's bad for my knees. Definitely not a good idea. Again, actually it's not the knees that are the problem. It is the hips that are the problem. Because as I showed you earlier, as soon as you try to accommodate for the fact that your hips aren't working, you will overstretch the knees, and the knees go forwards, and gosh, you've lost your toes again. So it's really important that these knees stay back and your bottom goes backwards. The best way to train this, and we start gently, is use a chair. Keep the back of your knees about 2 centimetres from the chair. They're not going to go forwards, they're going to stay there. And you're going to come back, and the chair's there, so it doesn't matter if you lose control, don't worry. And you sit down gently. There we go. Knees are fine. They never bent more than 90 degrees. There's not an excess amount of force going through those knees. Hips are now bent and you're sitting upright. So this movement will actually improve your posture as well as your hips. And then you come back up again, controlling it. Good. And then you bend your hips and you come forwards, keeping the backs of the knees very close to the chair. It's not the easiest movement initially, but it gets there, and you come down. Now, you'll notice that as I'm doing that, I'm actually bending forwards a little bit too far. Ideally, as you get better at this movement, in order to control it, you should almost stay completely upright. And your hips hinge and your knees hinge and you sit down in a nice controlled movement. If you find that you get to there and you flop, you need to control it a little bit more, and you just come back to there and work within your range. So always work within the range of movement that you have control of, and it'll improve. Day by day, it gets better.